First, set up your armamentarium as shown in this illustration. We'll be using indirect vision for this procedure. Before you begin any endodontic procedure, it is critical to first assess the restorability of the tooth. Probe the CEJ to gauge the approximate location of the pulp chamber. Ensure proper isolation of the appropriate tooth with a rubber dam. The clamp should be visible in radiographs. Next, envision the pulp chamber outline on the lingual surface. For maxillary central incisors, this outline should be triangular with the apex of the triangle oriented gingivally. Optionally, you may draw the outline on the lingual surface. Preparations should be approximately concentric with the overall outline of the tooth, according to the law of concentricity. For the CDCA, the incisal aspect of the opening should be approximately 3 mm from the incisal edge, but at least greater than or equal to 2 mm. At its widest point mesiodistally, the width of the preparation is about 3 mm and no more than half the lingual surface width mesiodistally. Do not violate the marginal ridges. Your access opening should be about 2 mm from the distal aspect of the marginal ridges. Using a high-speed handpiece, orient the burr perpendicular to the lingual surface. Burr options include carbide burrs, numbers 330 and 557, number 2 and number 4 round burrs, and the Endo Acces burr. For the CDCA, we recommend using the number 2 round surgical burr. Penetrate the tooth to a depth of 2 to 3 mm to enter the pulp chamber. As a clinical note, as long as the size of the burr is smaller than the size of the chamber, the operator will feel a drop upon entering a non-calcified pulp chamber. Reorient the burr to coincide with the long axis of the tooth and begin to shape the axis outline, starting in the center and working outwardly. First extend incisor-cervically to create the height of the triangle, and then extend mesiodistally to form the base of the triangle. Finally, connect the mesiodistal and incisor-cervical extensions. Burr options for this step include carbide burrs numbers 330 and 557, the Endo Z burr, and an 857 or 858 thin diamond burr. For shaping the access chamber for the CDCA, we like using the 857 or 858 thin diamond burr depending on your comfort level with safe end versus non-safe end burrs. After shaping the access opening, remove the pulp from the pulp chamber using a spoon excavator. Next, ensure that there is straight line access to the orifice opening using the Endo Explorer. Finally, smooth the walls of the access chamber using a high-speed or low-speed handpiece. If you nick the tooth, don't panic. Use the rubber tip to polish the nicked spot. Besides, for the CDCA exam, small ledges and nicks are okay. In order to fail, the gouges must be excessive or compromise the integrity of the tooth. It's time to examine and assess the access opening. Be sure that your access opening has smooth walls and straight line access. For the CDCA, your access opening should be 3 mm from the incisal edge, 4 to 5 mm from the CEJ, and 3 mm at the base of the access opening mesiodistally. The width of the preparation should be no more than half of the lingual surface width mesiodistally. The marginal ridges should be kept intact. Additionally, your access opening should be about 2 mm from the distal aspect of the marginal ridges. You can assess your completed access opening using our procedure checklist. Avoid your prep being too small. This isn't operative. However, make sure your access doesn't get too large. Surpassing the following dimensions could also lead to a fail: less than 2 mm from the incisal edge, less than 3 mm from the lingual CEJ, and less than or equal to 1 mm from the marginal ridges. Thanks for learning with us.